We need facts, we need information, and we need it quickly. If we don't have testing, we don't know the full scope of the problem. And if you don't test people, then you have no idea how many people are infected. We don't even know where community transmission is happening. We don't know where to direct resources. We are operating in the dark. They have distributed 1 million tests and will be distributing 4 million. My question is whether the administration and President Trump is exacerbating the crisis by downplaying it. Over and over again, we've heard blatant misstatements that consistently diminish this crisis and negatively affect our preparations and response. Is moving to chair yet another committee, Ranking Member Jordan.
Thank you, Madam. Oftentimes in this committee, we disagree vigorously on many hot-button issues. We don't always see eye to eye on matters of oversight. But on this issue, I think we should all work together for the health and well-being of every American. We should not play politics with the coronavirus. We should not use it as a reason to advance partisan objectives. Now is the time for us to come together under President Trump's leadership and work to help all Americans.
The worst yet to come, Dr. Fauci.
Yes, it is.
Can you elaborate?
Well, whenever you have an outbreak that you can start seeing community spread, which means by definition that you don't know what the index case is, and the way you can approach it is by contact tracing. When you have enough of that, then it becomes a situation where you're not going to be able to effectively and efficiently contain it.
Support the healthcare system through the hospital preparedness program and our regional disaster.
So I can say we will see more cases and things will get worse than they are right now. How much worse we'll get will depend on our ability to do two things: to contain the influx of people who are infected coming from the outside, and the ability to contain and mitigate within our own country. Bottom line, it's going to get worse.
Well, bottom line, Mr. Fauci, if we don't test people, then we don't know how many people are infected. Is that correct?
That is correct, and as I'm sure that Dr. Redfield will tell you, looking forward right now, as commercial entities get involved in making a large amount of tests getting variable, when you do two aspects of testing. One, a person comes in to a physician and asks for a test because they have symptoms or a circumstance which suggests they may be infected. The other way to do testing is to do surveillance, where you go out into the community and not wait for someone to come in and ask for a test, but you actively proactively get a test. We are pushing for that.
My home state of New York has 173 confirmed cases.
The CDC's role in this was we very rapidly, within almost 7 to 10 days, developed a test from an unknown pathogen once we had the sequence. And we did that because we wanted to get eyes on it at CDC so the health departments across this nation can send samples to us and we would test them. Secondly, we rapidly tried to expand that and scale it up with a contractor so each public health lab in this country would have that test. During that process of quality control, we found out one of the reagents wasn't working appropriately, and we had to modify that with the FDA. That took several weeks to get that completed. But the test was always available in Atlanta. If you send.
Thank you. I now recognize the gentleman from Massachusetts, Congressman Lynch.
But, you know, we really need honesty here. And when the president is making statements like this, we need pushback from the public health officials. You know, standing behind him and nodding silently or an eye roll once in a while is not going to get it. We really need, you know, when I say things, they're immediately considered political because I'm a Democrat and I'm elected. But, you know, you have a certain level of credibility and honesty that I think that should be persuasive to the American people.
The gentlelady from North Carolina, Mrs. Fox, is recognized for 5 minutes.
Thank you, Madam.
So I just ask you to be more forthright when the president makes statements like this. We need leadership, but we need people to be very much aware of the dangers that are out there. You know, the cases